Hello there folks. In this video we will be discussing one of the most dreaded illnesses during old age, dementia. Dementia is the loss of cognitive function in a person brought on by an illness that causes memory loss or a generalized brain damage. Early onset dementia is a term used to describe dementia that starts before the age of 65. Dementia is derived from a Latin term for insanity. It might be viewed as a nonspecific disease condition where memory, language, attention, and problem-solving parts of the brain are significantly damaged. Up to a point, dementia may be managed medically, but as the condition worsens, its symptoms become irreversible. Depending on the disease's cause, the symptoms of the condition could or might not be treatable. Less than 10% of people will have total relief from dementia symptoms. If a thorough evaluation of the patient's history is not performed due to the symptoms being relatively similar, dementia and the short-term syndrome delirium may be mistaken for one another. Dementia and delirium can be distinguished from one another using depression and psychosis. There are several dementia subtypes, each with somewhat different symptoms. Different kinds of symptoms may overlap, thus nuclear brain scanning methods are used to make the diagnosis. Alzheimer's disease, vascular, frontotemporal, and dementia with Lewy bodies are the most prevalent kinds of dementia. One or more kinds of dementia may be present in a person at once. There are several varieties of dementia, and they are categorized mostly according to the severity of the symptoms, whether they may be reversed, or the parts of the brain affected. 1. Alzheimer's disease. The most prevalent kind of dementia that affects people 65 years of age and older is Alzheimer's disease. According to reports, this illness affects 4 million people in the United States. Every year, there are 360,000 new instances of Alzheimer's disease recorded, and 50,000 Americans pass away from the condition. The majority of people get symptoms beyond the age of 60, however early symptoms can sometimes be inherited. Within 7 to 10 years, the condition results in a steady deterioration in a person's cognitive abilities, and practically all brain processes connected to memory, movement, language, judgment, conduct, and abstract thought are severely compromised. Amyloid plaques and neurofibrillary tangles are the two main abnormalities of the brain that are commonly linked to Alzheimer's disease. Memory loss, mild behavioral changes, and poor judgment are signs of the disease's early stages. Memory and language problems worsen as the illness advances, making it more difficult for the patient to carry out everyday tasks. 2. Vascular dementia. Following Alzheimer's disease, vascular dementia is the second most frequent cause of dementia. It makes about 20% of all dementia kinds and is caused by brain damage brought on by cerebrovascular or cardiovascular issues. The effects of genetic disorders, endocarditis, and amyloid angiopathy are also significant. It is also known to coexist with Alzheimer's disease, which affects both men and women equally and proportionally and whose prevalence rises with growing age. Immediately following a stroke, symptoms often strike. Patients may have a history of vascular illness, heart attacks, or excessive blood pressure. Sometimes the symptoms go away on their own over time. Vascular dementia is known to impair the midbrain, which alters a person's cognitive function. Incontinence and sadness are common ailments that people may experience. 3. Lewy body dementia, LBD. One of the most prevalent forms of progressive dementia that occasionally affects people without a documented familial history of the condition is Lewy body dementia, LBD. Cortex and substantia nigra cells in the brain die, and Lewy bodies, aberrant structures that are characteristic of this illness, are found in the surviving substantia nigra cells. Lewy bodies, which are composed of the protein alpha-synuclein linked to Parkinson's disease and other illnesses, may also infect the cortex. Concerning the buildup of this protein in nerve cells, researchers are unable to provide appropriate answers. 4. Frontotemporal Dementia, FTD. Degeneration of the nerve cells in the frontal and temporal lobes of the brain is the hallmark of frontotemporal dementia, sometimes referred to as frontal lobe dementia. However, this condition lacks amyloid plaques, but it does include neurofibrillary tangles, which interfere with cell function and cause cell death. According to experts, frontotemporal dementia makes up between 2 and 10% of all dementia cases. Between the ages of 40 and 65 is when the symptoms often manifest. Some persons have a family history of the illness, and in such circumstances, genetics has a significant impact on the condition. After receiving a disease diagnosis, people with this ailment may survive for up to 5 to 10 years. The frontal and temporal lobes of the brain are involved in decision-making and social conduct, but with this condition, since the nerve cells are being killed, the person has trouble making decisions and maintaining social connections. 5. HIV-associated dementia, HAD. AIDS and this type of dementia are both brought on by the human immunodeficiency virus, HIV. The brain's white matter is being destroyed by HIV-associated dementia. Memory loss, apathy, social disengagement, and trouble concentrating are typical symptoms. Later on, people frequently experience movement issues. Although there are now no effective treatments for the symptoms, those used to treat AIDS may assist to lessen some of the symptoms. 6. Huntington's Disease, HD. Children of people with Huntington's disease have a 50% chance of inheriting the gene, which results in the production of the Huntington protein, which is a genetic condition. There is extensive damage to the spinal cord and brain. A person may survive for 15 years after being diagnosed with the condition, and the symptoms often appear in their 30s and 40s. Mild personality changes including anxiety, anger, sadness, and muscular weakness, as well as irregular body motions, clumsiness, and gait problems, are among the common symptoms. 7. Dementia pugilistica. This condition, which is brought on by severe brain injury, is also known as Boxer's syndrome or chronic traumatic encephalopathy. Dementia and Parkinsonism are the most prevalent symptoms, and those who suffer from these conditions have slurred speech and impaired coordination. A single brain injury can also result in post-traumatic dementia, PTD, which is marked by difficulties with long-term memory. 8. Corticobasal Degeneration, CBD. It is a degenerative illness characterized by nerve cell loss and atrophy of several brain regions. Tau protein accumulates abnormally in brain cells, and it takes the illness 6 to 8 years for symptoms like stiffness and impaired coordination, which are comparable to those of Parkinson's disease, to manifest. Memory loss, dementia, visual spatial issues, apraxia, halting speech, and trouble swallowing are further symptoms. Pneumonia or other lung illnesses may result in death. The basic symptoms of corticobasal degeneration disease can be treated with medications like clonazepam, but there is no effective therapy for the condition. Now let's identify the causes of dementia. The loss of neuronal transmission or the death of nerve cells are the causes of dementia. The human brain is a tremendously sophisticated system, and many things can affect how well it functions. Though the causes of dementia have been identified by academics, further research is still needed. The development of dementia symptoms in the brain and the existence of aberrant inclusions in the brain are used to distinguish between various forms of dementias, such as Alzheimer's disease, Parkinson's dementia, and Pick's disease. When lifestyle factors and environmental effects are significant in the development of various kinds of dementia, genes also play a significant role. Numerous genes have been shown to enhance a person's risk of developing Alzheimer's disease, but 3 mutations in genes that govern the synthesis of proteins including amyloid precursor protein, APP, presenilin 1 and presenilin 2 are particularly significant. Apolipoprotein E gene variation is to blame for the development of Alzheimer's disease's late symptoms. Possible dementia treatments. Treatment for dementia is based on the underlying illness. Many diseases are permanent, but they can be treated to reduce their symptoms and prevent additional harm. Some situations, nevertheless, can be resolved via treatment. The standard medical procedures that they recommend are intake of vitamins for cases with deficiency of vitamin B12, administration of thyroid hormones for hypothyroidism. Surgery can be conducted if the cause of dementia is a tumor. In case dementia is a result of the side effects of a medicine, then the medicine will be stopped or changed. Medicines are prescribed to treat infections affecting mental state. Treatment for reversible conditions caused by AIDS, medicines like cholinesterase inhibitors, memantine, Namenda, antidepressants and medicines to ease anxiety, agitation, aggression, and hallucinations can be administered to the patient. I hope the video has provided you with good information. Please don't forget to like and subscribe.